I decided to make a video for people who deal with various hand ailments due to guitar players and my Axe Effects buddies out there. You guys have all helped me so much. I figured I would share some of my knowledge and what I do in physical therapy, working in an outpatient orthopedic clinic. So I'm going to cover basic stretching first, and then we'll talk about some tendon glides and some nerve glides. And it's amazing how many people go to therapy or different clinicians and they never hear about some of these other kind of special ways of treating because they're not as straightforward, and it's just stuff I've picked up over the years from other clinicians and in continuing education courses. So your basic fundamental stretching for all guitar players, just maintenance. A lot of other guys use computers and things like that, and maybe you work construction, whatever, and we all overuse our hands and forearms and gripping and get thumb pain and lateral epicondylitis, which is just your extensor muscles being too tight, pulling on this tendon. So I'll start with that one. So basically, if you ever get pain here, or if you're just feeling tight here, you should go down like this, thumb down, feed this hand through. I'm pulling with this hand in this direction, stretching this elbow. So this is an extensor stretch. Some people show it like this. This is way more effective. A simple stretch here will get you a good extensor stretch, but if you deviate down, it's called radial deviation is a technical term. Doesn't really matter, you just pull it down, and I rest my shoulders down. You don't need to be up here because then you're going to get shoulder pain and you don't want to do that. Okay, so that's that one. I do these often. You can hold it up to 20 or 30 seconds. If you do it 10 seconds, it's going to feel really good. Tight through here. If you have pain here and you restore the elasticity of the musculature here, along with some icing, it decreases the tight muscles pull on the tendon. Muscles stretch, tendons don't. That's where a lot of the pain comes from. If it's here, it's your flexors. And I like to do it like this. Some people show it like this. Not as effective as this. I found this is way more effective. Point your fingers backwards. If you have limited range of motion, you can't get there. You might have to hang your fingers off the edge like that. So those are the two main muscle groups. Your flexors, stretched like this. Your extensors, so you guys that use the keyboard on a computer all day long, even if you're on a wrist support, you're still in slight extension. These guys are constantly contracting and they pull on a tendon that doesn't stretch, so he gets pissed off, and that's what the itis is in an epicondylitis or any sort of itis. It's just swelling of a tendon because of a tight muscle. So you stretch, you can put some ice on it. So those two stretches, and then a thumb stretch is very, very important. I love this one too. I do a lot of rock climbing. My hands get very, very sore. We do some pinch training, and then obviously you're playing your guitar so you can get some thumb pain. Grab your thumb, pull it down. If it hurts too much, you should know the difference between good stretch, and you have these little things called stretch receptors in your joints and muscles, and they give your central nervous system feedback, and if it's telling you stop, then listen to it. So it should be a good stretch stimulus, not pain. So those are your basic stretches. Everyone should do those, along with these. Always feel really good too. Pretty straightforward. Just stretch your fingers. If you have range of motion deficits, say you had a trauma, something like that, you want to learn what tendon glides, nerve glides, and I'm going to show you what that is. So a tendon glide, the tendons live in sheaths. They run through these little sheaths. Tendons and nerves love blood flow. So the way you're going to get the tendons of your hand blood flow is you're going to do a glide like this. You're going to go 90 degrees at the first joint. You're going to go down to here, then you're going to pull it up tight. Straight, 90, go to the cusp, palm of your hand, pull it up tight. You can do a little extension if you want to add that. Doesn't seem like much, but if you have some finger pain or injuries, you'll benefit greatly from that by getting blood flow. Blood flow always equals healing. The other one, I'm going to show you 3 specific nerve glides, and nerves love blood flow. Nerves live in sheaths as well. So this is an ulnar nerve that runs down here. If you get radicular pain or buzzing neural tingling type of pain, it's called radiculopathy, or you'll hear a therapist call it radic, and you're going to do a glide like this. Just simply like this. If it lights you up and you're like, oh, I don't like that, Just find where you can be successful with it. Tomorrow maybe you'll do a little more range of motion, but you curl from flexion to extension out like that. If you get carpal tunnel type syndrome, that's your median nerve travels through this little tunnel right here. You can do this, it's just called a nerve bounce. I'm not stretching really hard. You don't want to stretch nerves. Nerves don't stretch, and they don't like to be stretched. They like to be glided through the sheath. So you just, I'm bouncing this one, just doing this. Oftentimes will make it go away. You should be wearing carpal tunnel braces at night. I do because I rock climb and have drilled a lot of routes and done a lot of stuff over the years and still have to chop wood and stuff in our yard, and I want to be able to play guitar. So I wear braces at night because you don't want to end up with permanent damage. People who end up losing strength with carpal tunnel, extreme carpal tunnel symptoms during the day, you lose strength, constant numbness, tingling, that's when you have to start thinking about a surgery. I've dealt with the symptoms for 6 or 7 years, and it's only at night or if I hold a telephone, something like that. So I wear the braces and really don't deal with it. Sometimes when it's cold I feel it. But I'll do these nerve bounces, and that's the median nerve. The radial nerve is this one called a waiter's tip, like this. That's just what they named it years ago. And you're just going to do this. You're going to tilt your head to the side. Tilting it towards it is a less intense slide of this radial nerve that comes down. I'm sorry, it's right here. And you're going to do it like this, or you can do your head away, and it's kind of a little bit more stressful on the nerve, and you can play with it. This is the #1 thing anyone will ever share with you. This is ice water. Very, very cold. I mean, in 30 seconds, I'm dying to get out of that. This is called a contrast bath because you're constricting the vessels and then you're dilating the vessels by going into water, warm water. A lot of times I'll go out to my hot tub if you have a hot tub, take a bucket, a Tupperware of water. Sometimes I'll keep it in my refrigerator, just water in the refrigerator, and I can put a little bit of ice in there. But this should be so cold that in 30 seconds, you're dying to get it out of there. And then once you go, basically 30 seconds, 2 minutes, the vessels dilate, you're getting blood flow, your hands will immediately feel better. So if you're ever feeling like, man, they're tight, they're arthritic, they're whatever, I don't feel like I can play, I can make band practice, do this, you will feel better immediately. There's a number of other strengthening ones you can do. This is a dumbbell. Most of you guys won't need to do that, but what you're going to do is go extension here. This is your extensors are strengthening, your flexors, and I always isolate the forearm here. This is called radial and ulnar deviation. You're doing like a hammer motion, and then pronation and supination. So extension, flexion, this way, this way, this way. So again, this is going into if you've had an injury, how do I strengthen my forearm, my hand? You can take a piece of TheraBand and do extension like this as well. But if it's not a strength issue, a lot of times it's just stretching out what's overused.